It's a rare trip to the park for Ed and his mum, Alex. Since the start of the pandemic, she's been protecting him from catching COVID-19. She says she's terrified of him becoming infected.
It's important for me to protect him because if he becomes ill, he'd have to go into hospital and I wouldn't be there for him. I don't think they'd let me be with him. And that frightens me and it frightens him. And I'm not sure how he'd cope fighting the virus.
Ed is 27 years old and needs full-time care because of his learning disability and physical needs. His mum says she was surprised to recently discover that he's not a priority for a vaccine.
I was upset when I heard that he wasn't going to get it, and I was really surprised that he hadn't been pulled forward in that list. He's vulnerable, and I wonder if we've been forgotten at home because we care quietly at home, or we have forgotten minorities.
I understand about the viruses, that the virus, because I haven't had my vaccine, and I'm very vulnerable. I am, because I haven't had it at all.
A report by Public Health England found that during the first wave, adults with a learning disability were up to 6 times more likely to die from coronavirus than the general population. This figure went up to 30 times more likely if they were aged between 18 and 34. And 80% of deaths for people with a learning disability were COVID-related in the week ending the 22nd of January.
Adults with Down syndrome are in category 4 of the priority list. And then the government said that people with severe and profound learning disabilities can be in category 6. Now, our concern here is that there's no definition of severe or profound. And so it's really left to GPs to decide, and that lots of people with mild and moderate learning disabilities are being missed out. And so there's no evidence to suggest that people with mild and moderate learning disabilities are at any less risk. And it's really important that they should be prioritised.
Chris is also concerned. He cares for 21-year-old Chloe, who has a moderate learning disability.
Chloe getting the vaccine is really important because Chloe's understanding of the virus and the way she would deal with it, the same as us, is different. We've had to really minimise the amount of time Chloe spends out in the public with public, because she tends to charge in and she doesn't understand people's personal space and the 2-metre rule especially.
I looked it up online and loads of people have died from it. And I think it stops you breathing or something. I am not that frightened of getting it because I don't think I'll die from it, but I don't know really.
The government says it's working as hard as possible to vaccinate as quickly as possible those most at risk, as advised by the Joint Committee on Vaccination and Immunisation. The JCVI says the single greatest risk of death from COVID-19 is older age, and vaccine prioritisation is primarily based on age. Since our filming earlier this week, Ed's GP has today agreed to vaccinate him imminently, but there are many others like him who still have to wait. Balvinder Sidhu for ITV News.